Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Myocarditis, and you're looking at its causes. So causes of myocarditis, first the heading will be the infections. So infections, it causes myocarditis. So what type of infections? Now we look at viruses. So viruses causes the myocarditis. So the viruses such as the Coxsackie. Go in terms of the Coxsackie virus. Next, there is also a presence of the ECO. So in terms of ECHO and then the influenza virus, then comes the HIV as well as the CMV, that is the cytomegalovirus. Next type of virus, it includes the next type is the chlamydia. So the other infections are the chlamydial infections. So there is chlamydia. Next is the presence of the rickettsia. There is rickettsia. And then, so in terms of chlamydia, it is a chlamydophilia. It is a chlamydophila psittaceae. Whereas in terms of rickettsia, it is nothing but the rickettsia typhi. It is the rickettsia typhi. And also the typhus fever. So rickettsial typhi as well as the presence of the typhus fever. Next is we look at the bacteria. So how is the bacteria? So in terms of bacteria, is the Corynebacterium diphtheria is involved. So Corynebacterium diphtheria is the one which is involved. Next is the Neisseria meningitis. Meningococcus. So diphtheria, meningococcus. Corynebacterium diphtheria as well as Neisseria meningococcus. So then we also have the infections caused by the Borrelia. So infections caused by the Borrelia. So Borrelia, the example is the Lyme disease. Now we look at the fungi. So what are the fungi which causes the myocarditis? Fungi it causes by the mainly the Candida species. So Candida species causes the fungi. Then also the protozoa causes the fungi. The protozoa, it includes the Trypanosoma cruzi. So Trypanosoma cruzi can cause the myocarditis, and Trypanosoma cruzi is famous for the known as the Chagas disease. As well as there is involvement of the toxoplasmosis. So there is presence of the toxoplasmosis. Then there is also presence of the helminths. So helminths, it includes the trichomonas. So helminths includes the trichomonas. Trichinosis. So helminths, it includes the trichinosis, not the trichomonas, trichinosis. So trichinosis. Next we look at the post-streptococcal. So what is the post-streptococcal involving? So in terms of the post-streptococcal involvement, so here the post-streptococcal, it involves a rheumatic fever. So rheumatic fever, and then comes the immune mediated reactions. The immune mediated reactions, then comes also the presence of SLE. All this can lead to the myocarditis. And there is also the presence of the other headings include the drug hypersensitivity. So there can be drug HS, that is the hypersensitivity. So the example here is nothing but the methyl dopa. So methyl dopa is a very good example, as well as the presence of the sulfonamides. Sulfonamides also lead to the drug hypersensitivity. Then comes the transplant rejection. So there is involvement of the transplant rejection, and there is also the presence of the sarcoidosis. So there is transplant rejection. Next is the sarcoidosis, as well as the giant cell myocarditis, as well as there are some unknown causes. Now let's look at the morphology of this. So as per the morphology, the heart in myocarditis, it may appear as normal or dilated. So it is normal or as it is dilated, and some hypertrophy may present depending on the disease duration. So there is a mural thrombi. So there is a very common, that is a mural thrombi is seen. So mural thrombi is seen, and the active myocarditis is characterized by a interstitial inflammatory infiltrate. So active means there is presence of the interstitial. There is interstitial inflammatory infiltrate. So interstitial inflammatory infiltrate. So this is associated with the focal myocyte necrosis. So this is associated with focal myocyte. So it is associated with the focal myocyte necrosis. Next is there is involvement of the endomyocardial biopsies. So this endomyocardial biopsies, endomyocardial biopsy. So this endomyocardial biopsy, they are diagnostic in some areas, but not when inflamed is focal or patchy. So the endomyocardial biopsies, they are diagnostic. They are diagnostic in some cases, but not when inflammation is focal or patchy. It is not. When it is inflammation is focal or patchy. Focal or patchy. Next, we look at the morphological pattern of myocarditis in certain conditions. So what is the morphological pattern? So when you look at the morphological pattern of myocarditis. So the morphological pattern here is there is HS, hypersensitivity myocarditis. So hypersensitivity myocarditis is an interstitial infiltrate with a high proportion of eosinophils. So it is nothing but the interstitial. It is an interstitial infiltrate, and it has a high proportion of eosinophils, high proportion of the eosinophils. Next is there is a other morphological pattern. It includes the giant cell myocarditis. So there is giant cell myocarditis. So in terms of giant cell myocarditis, there is a multinucleate giant cells. So multinucleate giant cells, MN giant cells, multinucleated giant cells. So they are fused macrophages. So multinucleated giant cells, they are fused macrophages. They are nothing but the fused macrophages. Next is it is also involvement of the Chagas disease. So what is special about the Chagas disease? The Chagas disease is nothing but scattered myofibers by the trypanosomes. So it is scattered myofibers. It is scattered myofibers, and it is by the trypanosomes. To learn and grow daily like this, please do subscribe.